Welcome to week 6. We've talked about what instructs the ventilator to trigger the inspiratory phase of a breath and what to do during inspiration. Now, we need to cover how we instruct the ventilator that it is time to end inspiration and let the patient exhale. This transition is called cycling and is governed by the cycle variable. We'll start with the most intuitive and most explicit cycle variable, which is I time. Here, we'll tell the ventilator how long inspiration should last, and once that time has elapsed, the ventilator will close the inspiratory valve and open the expiratory valve to let the patient exhale. In some ventilators, however, if you use volume control, you won't see a knob for you to choose I time. In these vents, I time is specified by the combination of flow and tidal volume. Imagine you choose a constant flow of 60 liters per minute, which we'll call 1 liter per second for simplicity. If you choose a tidal volume of half a liter, what will your I time be? Yes, 0.5 seconds. If you wanted to shorten the I time further, you would either increase the flow or decrease the tidal volume. So effectively, your combination of flow and tidal volume will give you the I time, which is calculated by the ventilator. Usual I time values are between 0.5 and 1 seconds. Throughout the course, we'll talk about situations where you may want to shorten or lengthen that I time from this starting point. But now, let me ask you a question. Do you control for how long you inhale? Although unconsciously, the answer is yes. Your central nervous system controls every aspect of your breathing, taking several factors in consideration. Think now of the cycle variables that we talked about. The patient really has no control over their I time. If you choose an I time of 0.8 seconds and the patient wanted to breathe for 0.5 seconds, then they simply have to wait for 0.3 seconds receiving gas from the ventilator until they can exhale. Look at this picture where we set the I time to 1 second. Here, as you can see. At the end of inspiration, you can see an increase in airway pressures to higher than what you would expect by adding the amount of pressure the vent is generating, as you can see right here, to PEEP, right? Those two added will be 10, and the peak pressure here is reading as 15. What is happening in this case is that at the end of inspiration, the patient is contracting their expiratory muscles, raising airway pressures to a total value of 15. This means that this patient wanted to breathe for a shorter amount of time than what we had set. On the other hand, if the patient's desired I time, which we'll call neural I time from now on, was 0.8 seconds, and you set the I time to 0.5 seconds, the patient may extend their inspiratory effort past the end of inspiration into expiration, potentially triggering an additional breath. This can be exemplified looking at this other clinical scenario. Here, we had set an I time of 0.7 seconds, but probably the patient wanted to breathe for longer because, as you can see here, I have some arrows for you, the patient triggers the first breath and they're still actively breathing at the end of inspiration, triggering a second breath, leading to a variation of breath stacking that is called early cycling. On Module 5, we'll discuss the details of interpreting vent waveforms, so don't worry if you wanted a more detailed explanation on that. We'll get there. My final question for you today is, can you think of a signal the ventilator could look for that would act as a surrogate of neural I time? Think about it, because that will be the topic of our next lecture. I'll see you then.